so much, Helly. And I think I'll be adding another piece to our ongoing conversation today, so I'm really happy about that. And just wanted to add, it's been wonderful to meet everyone here so far, and hope we can continue the conversation. So today I'm going to speak about why we need new data sources in population public health surveillance. And I'm going to explain what I mean by new data sources, population, and public health. So traditional public health reporting, as we all know, involves us going to see some kind of healthcare professionals, such as physicians or community health workers. They feed information along with laboratory confirmed information to local officials, and then that information is aggregated and goes on to ministries of health, and then onto other bodies like the CDC or the WHO. So we have this kind of chain of command structure. But the reason we need to aggregate this data and look at the data from all of the public in general allows us to understand a lot more about disease and how they spread. So this is a map of London from the 1800s, and there was a famous physician named John Snow, who you may have heard of, who was actually able to plot on a map all the locations of people who were really ill and who later turned out to have cholera. And by superimposing the locations of where people were ill and some contaminated water sources, he deduced the reasoning for why people were getting sick and how cholera was spreading, which was through the water. So in order to do that, he had to bring the data together and kind of look at it on this map. But today, what's going on? Well, in about the last 15 years, in about that time period, we see that there's a lot of new infectious diseases that are emerging or re-emerging around the world. And at the same time, I like to think that we also have other things that are emerging around the world, which may be responsible not for infectious diseases, but some other kind of disease prevalence. And so this is data from the WHO that shows that in about the same time period, so about the last 10 years, the worldwide prevalence of obesity has actually increased quite dramatically. So you can see country by country how that's gone up. So with these new data sources that we've all been speaking about so far, we view that all of these bodies can now communicate more directly. So information can flow a lot faster, and that will lead us to understand more quickly when disease events happen, and also get better resolution in space and time. So this is an example from Google, which we're lucky to have Matt here, where they showed there have been lots of investigation about how online search queries could correspond to disease spread, and Google's work was probably one of the most famous, showing that certain search queries related to the prevalence of people with influenza-like illness, according to the CDC, the Centers for Disease Control and Prevention's data. So this was back in I think the site went live in maybe 2009. And so it wasn't necessarily that we know the people who are searching are sick with influenza. They could have been searching for their family members or just because they heard something on the news, but it was a good proxy for what was going on. But these days, there's a lot of other digital sources of information that in a disease outbreak could give information or be proxies for what's happening. So where else can we look? Here's one example. So there's a Chinese pharmaceutical company called, my pronunciation in Chinese is horrible, but Guangzhou Baiyunshen Pharmaceutical. And this is their stock price over time. They manufacture a herb that's commonly known to alleviate symptoms of acute respiratory illness. So if I have like cold symptoms or something like a flu, I would buy this herb. So what happened was in January of 2003, their stock price, increased dramatically, and school kids, the reason for this was that a lot of school kids were getting sick with something like the flu, and so they were buying this herb in mass quantities. But it wasn't until March of that year that it was later found out that it was a new infectious disease and was named SARS. So this just shows us how we can get an earlier indication of what's happening, perhaps from some data sources that we wouldn't normally think of. I'll just quickly as well, recently there's also been H7N9, a new bird flu emerging in different areas of the world, and some of the earliest information about that has been made public on Weibo, which is the Chinese version of Twitter. This is a screenshot from a hospital record that someone actually took that it indicates that there were human cases of H7N9, and they posted this onto Weibo. And that caused the Chinese government to then quickly reply and respond to this and make the information public, and they also did that on Weibo. So I'm going to step back and talk about not an infectious disease, but obesity, which I showed the worldwide prevalence increase over the last few years. And because it's increased in such a short time period, we kind of realized that it's not just genetic factors that are changing, but there are other environmental drivers for this change. And so when we think about the environment, there's many components to that. Of course, there's the built environment, so such as things like the availability of fresh foods that we heard about earlier, but there's also the social environment. So there's a pretty famous study you may have heard of by a group at Harvard that actually showed that obesity is a social phenomenon. So they took information from this longitudinal study of people's cardiovascular status, and they showed that there were actually clusters of people who were more or less obese. And I won't go into it here, but they showed that it was actually a person-to-person effect. But of course, that was limited to this community in Massachusetts and a pretty small size, about 10,000 people. But these days, we have a lot more information about people's social networks through, for example, sites like Facebook, which has 1 billion people on it and active and growing. So we actually decided to look and see if there was anything on the online social environment that could relate to people's actual health outcomes. So on the left, I'm showing the prevalence of obesity by city across the US, and places which have a higher proportion of people who are obese or overweight are in red, and less obesity is in blue. And so you can see there's a commonly known area called the obesity belt, kind of around the south of the United States. And at the same time, we took interests online just at the population level, and it's all anonymized information, so we don't have anything individually identifying, but just looked again at the percentage of people in each of those cities who have activity-related interests online. And again, the less interest is in red, which you can see, okay, it kind of corresponds to where the obesity belt area is. So because we also have very fine spatial resolution from the online data, we could actually do this even within cities. So we did this within New York City, which, again, more obese areas with more prevalence of obesity are in red. So you can see Manhattan generally has less obesity, as maybe some would expect. And then instead of activity-related interests, looked at more sedentary-related things, like how much people are interested in television online. And so again, we saw some kind of like, oh yeah, this could be, related. So I won't go into the statistics, but we showed that actually, yes, there was a relationship there where when in places where there's more activity-related interests, there was less prevalence of obesity, and conversely, more television-related interests had more obesity, and that was all statistically significant. But some of the issues with passively available data, as you can think of, is that they're not very specific. So again, we don't know, for example, for Google Flu Trends, we don't know specifically who is sick, and also things can change over time. So for example, this is from an article from Nature, where they showed that for this last year, Google Flu Trends didn't really match up with what the CDC expected, and that's in purple. So I'm going to talk about a system that we built at our group, which ended up matching a little bit more and gives us a little bit more indication of actually who is sick, but still uses the online platform and enables us to get data very quickly. So it's called Flu Near You. You can check it out at flunearyou.org. There's an app also. Basically, it's a platform in which anyone can be a flu sentinel. So if you sign up, you get an email sent to you once a week that asks you about 10 symptoms. If you've had any of them, you can check it off, and that's on the next screen, but here's just showing you how to sign up. You can do it through Facebook, so you get some more social information. Here's the survey with the 10 questions, and then we also ask, if you didn't have any of those, to tell us if you were well, so that way we get a better indication of actually, okay, what proportion of people are sick. So this is what the website looks like. And it shows you the map so you can take a look at who's actually sick near you. This is what it looks like when there's actually a lot of flu going around. And there's about 40,000 people across the US who are active on the website. So from zooming in to near where you live or looking on the app, here I just took this from San Francisco the other day. You can see what the flu prevalence is or flu activity is near you. So in general, just to sum up a little bit, the vision is that we can use data mining and participatory health to actually engage people, make them more proactive and involved in their own health versus through this kind of chain of command structure of traditional public health. And that can actually help us make real impact in public health. I'll take a few seconds to talk about what we actually do with the data, because I always like to keep in mind how we can actually intervene if we have information. And for populations, that's really great because a lot of times public health interventions are going to be at a population level. So for example, in places where there isn't an existing healthcare infrastructure, this is a picture from Mumbai. Some of the work we're doing is actually, instead of doing flu surveillance, we're asking people about malaria status and diagnosis and risk factors. And we're using the Amazon Mechanical Turk platform to do that, which works well because there's a lot of people in India already on there. And the map just shows you kind of what the existing state of knowledge is about malaria in India. So that's like a map that some collaborators of ours put together showing where we have malaria information, even though it's quite a huge country. As well, the data that we do have is pretty, it's on a very not fine spatial resolution. So the peninsula of Mumbai, which is highlighted there, just kind of shows you one homogeneous level, even though probably within the city there are different amounts of malaria activity happening. This is a picture that many of you might have seen showing all the geolocated Twitter postings and Flickr photos from Manhattan and surrounding areas. And of course, this can also be used, since we have very good geolocation, we can use the population information to target specific public health interventions like distribution of retrovirals or antibiotics, and of course, implement public health interventions like Mayor Bloomberg's that we heard about earlier. So thanks to everyone who contributed data to these studies, and also the people that I've worked with. And of course, maybe if you'd like to brainstorm how we can use your data, that would be a wonderful next step.